A very good morning, everyone. This is Namrata, your Bagdara Farms consultant. I'm live with all of you on this morning to discuss with you with a topic, which is not very much spoken about, but it is a very normal thing that happens to women after giving birth, right? So the topic for today's live is postpartum depression, also known as postnatal depression. Right? Let's wait for a few seconds, like maybe 5 to 10 seconds, if some viewers are going to join in, so then I can start talking about this topic on length, right? And also, like I always tell you, there are always natural ways, natural means to, combat a problem, to treat it, and to prevent the various symptoms and consequences that can happen if the problem is not taken care of, right? So today's topic is postpartum depression or postnatal depression. Let's begin with this topic. And in this, I'm also going to tell you that at Bagdara Farms, we have yet another supplement which we recommend for preventing or treating this problem of postpartum depression. And please understand, it is okay to talk about this problem. It is okay to discuss about this because this is a normal thing. This is a hormonal imbalance that takes place in a woman's body during pregnancy, after childbirth, and it is important to give importance, right, to these symptoms happening post birth. So let's start by talking about what is postpartum depression. It is also known as PPD. It is basically a complex mix of physical, emotional, behavioral changes that happen in some women after giving birth, right? So this is kind of a depression that occurs after childbirth, is what is known as postpartum depression. Sorry. Now, those who develop postpartum depression are at greater risk of developing major depressions maybe later on their lives. So, if it is not taken care of, or if it is in its aggressive form, this can lead to women having more kind of depressive episodes in later parts of their lives. Now, postpartum depression is linked to chemical, social, and psychological changes that happen inside the woman's body after giving birth, right? Now, PPD is a form of major depression that might, begin or happens within 4 weeks after delivery. So the time frame can vary from person to person, but this usually happens after childbirth, right? So the chemical changes involve a rapid, drop in hormones after delivery. What happens is, it is said that the levels of estrogen and progesterone, the female productive hormones, right, they increase tenfold during pregnancy. Now, what happens after you give birth? you know this suddenly sharply there is a drop in these hormones. So by 3 days, the third day after a woman gives birth, the level of these hormones drop back to what they were before the woman got pregnant, before the lady got pregnant, right? Additionally, there are various chemical changes that are also taking place in the body, like the social and psychological changes of having a baby also lead to an increased risk of depression, because everything is new for the mother, right? If it's the first time you're giving birth, it's the second time, every time the whole process of pregnancy is different for everybody, right? The social, the physical, the changes that happen in a women's body can vary for every pregnancy, right? So you can't just say that only a first time mother will have postpartum depression. No, anybody can have it because it is the circumstances, it is the life you're leading during your pregnancy. If you've been unwell of any kind of things, which are affecting your social thoughts, your physical well-being. So all of these things can contribute to affecting your uh, you know uh, your mindset post pregnancy, post giving birth to a baby. Now, most new mothers also experience the baby blues after delivery, right? That means they say about 1 out of every 10 women, will develop a more severe and long lasting depression after delivery. Now, they say about 1 in 1,000 women, right, develop a more serious condition called postpartum psychosis. I will be telling you what postpartum psychosis is in a few seconds when I discuss in length about the different kinds of, postpartum depression that people have. Now, like I said, baby blues is one. The most complex form of it is postpartum psychosis. Now, dads aren't immune, right? So, research shows that 1 in 10 fathers also get depression during the first year of their childbirth. See, as much it is new for the mother, it is also news for the father, right? But for mothers, it is more severe because you have been keeping the baby inside you for 9 months, going through all the changes. Those hormones are directly affecting you. But for a new father also, these things can lead to depressive thoughts, because for them also the life totally changes, right? So it can happen. This kind of depression or the depressive thoughts can happen both in men and in women. Now I'm going to be telling you about the signs and symptoms of postpartum depression. The signs and symptoms include trouble sleeping, appetite changes, fatigue, low libido, mood swings, being uninterested in your baby or feeling you are not bonding with them, right? This is a very normal feeling in postpartum depression. It's a very normal symptom where you don't feel yourself being attached to your baby. You are crying all the time, often for no reason. That means you're getting very emotional for things which you would otherwise not get emotional about. Depressive mood, anger, crankiness, loss of pleasure, feeling of worthlessness, hopelessness, helplessness. Sometimes people also have suicidal thoughts, thoughts of hurting someone else, trouble concentrating or making decisions. So these are all basic signs and symptoms which are there, which happen with postpartum depression. So, untreated postpartum depression can be dangerous for new moms as well as their children, right? A new mom should seek professional help. You should seek professional help. You should talk about your problem when you think it is going out of hand. And when do you do that? When system persists, the symptoms which you have persist for more than 2 weeks. They can't. You are not able to function normally. You're not able to cope with everyday situations. You have thoughts of harming yourself or your baby, feeling extremely anxious, scared, or panic most of the day. So if these symptoms, these things are, going on for a prolonged period of time and you're not able to take charge of it, and somewhere you know that this is going to harm you in the longer run, or your baby or the family that is around you, that is when you know that you need to take help, right? Now, postpartum depression also has various causes and its risk factors. Now, it's not because you did something wrong. Postpartum depression doesn't happen because you did something wrong. Expert thinks it can happen for many reasons, for and can be different for different people. So some things that can raise the chances of postpartum depression include a history of depression prior to becoming pregnant or during pregnancy, right? Age at the time of pregnancy. The younger you are, the higher are the chances, because you're not mentally prepared, you're not physically sometimes prepared to conceive and to go on through the pregnancy and to give birth. Your ambivalence to the pregnancy. Children, the more children you have, you're more likely to be depressed in a later pregnancy, because there's so much. You're managing your children, you're managing your house, and then there's another newborn baby. So that can also put you at risk of having postpartum depression. A family history of mood disorders, going through an extremely stressful event like a job loss, health crisis, any of these things, like the environmental factors, can also be affecting you, which can also lead to postpartum depression, right? Can also be one of the causes or risk factors for this. Having a child with special needs or health problems, right? As much as we love, we know that taking care of a child with special needs require you to be a special mom, you to be a super mom, because it is challenging, but in the end it's your baby. But this can also lead to somebody having postpartum depression, because sometimes you're not ready for what you're getting, and when we are not prepared is when we start panicking, we get anxious, we get cranky, right? So this is also one of the chances of you the causes, or you can say the risk factors, that can put you more at risk of getting postpartum depression is having a child with special needs, having twins or triplets, lack of sleep, marital conflicts, hormonal changes, anxiety, limited social support, having a history of depression or premenstrual dysphoric disorder. This is also a disorder which is there. And self image, that means you start feeling less attractive about yourself, you lost control over your life, etc. See, obviously life's going to change after you have a baby. It's not going to be same to what it was previously, but it will come back to what it was or near to what it was, provided you take care of your health, you enjoy the phase of motherhood which is there to do with your baby, right? So I don't think any woman should feel less should feel that she is anyway less attractive. Every woman is beautiful in its own way, and that whole process of motherhood, whole process of you know uh, going through the pregnancy, and is also a special phase for women, because we are the ones who can give birth to babies, we bring in new life into this world. So I can imagine that sometimes people may find themselves less attractive, but it is just a phase where you look different, but you still look beautiful in your own way, right? So now there are types of postpartum depression. There are three terms which are usually used to describe the mood after giving birth. First is baby blues. So 70% of women have it. That means mood swings, crying for no reason, get cranky, impatient, restless, etc. Then is PPD, like they say, postpartum depression can happen few days to months after childbirth. And the most complex of all, which is a serious illness which can happen, is postpartum psychosis. It is a serious mental condition, an illness that can affect new mothers. This illness can happen quickly, often within the first 3 weeks after childbirth. Women can lose touch with reality. They can start having hallucinations. They can become delusional, visual hallucination, that seeing things that aren't there. Other symptoms include insomnia, feeling agitated and angry. Women who have postpartum psychosis need treatment right away and almost, always need medication. So make sure you do not reach that stage. Make sure you talk to somebody, ask for help, right? Because see, the methods are various. You are put on medication, you put on treat therapy. All of these things are there. Antidepressant medicines will be given, anti-anxiety medicines will be given, but in the longer run these can also have side effects on your system. That's why we are here today to tell you that natural ways can also help in taking care of this problem of postpartum depression. Now, if you do not treat your postpartum depression, there are various complications that are going to arise. So postpartum depression, if is not treated, can weaken your ability to bond with your baby and can affect the whole family, right? So the complications, first, how does it affect you? Postpartum depression that's not treated, can last for months or longer, even turning into a chronic depressive disorder. Even with treatment, postpartum depression can, make you more likely to have episodes of depression in the future. So this is a complication for you. If you do not take care of yourself, if you do not talk about it and get a solution at the earliest stage, it is going to lead to more depressive episodes later on in your life. How a complication happens: the baby's father. When a new mother has depression, the father may be more likely to have depressive thoughts too. Because in the house, if you are having, a depressed person who's not uh, being up to what the person really is, then that can also affect the whole, balance of the family, because everybody starts to feel depressed because nobody knows how to deal with it, right? And it can also affect children. So children of mothers who have postpartum depression are more likely to have problems with sleeping, eating, crying. They can cry more than usual, and delays in language development. Now, how can you help yourself? You can help yourself by managing yourself after childbirth. So, here are some tips that can help you cope with bringing home a newborn. Ask for help, let others know how they can help you, right? If you will not talk about it, if you will not tell somebody that you're feeling depressed, or if you will not tell somebody that I need help, nobody is going to help you, right? So, the first thing of managing yourself, how to take care of yourself, is to ask for help. Be realistic about your expectations for yourself and your baby. You have to be realistic about your expectations. What are you expecting, for yourself and your baby? Don't have too many expectations from the little one. That baby is also new to this world. For as much as motherhood new to you, that child is, also experiencing everything for the first time. For example, if I talk about, if I take myself an example, if I am becoming a mother, right? I've still lived through few years and seen experiences of people to understand what life is. Understand that small baby who's just come into this world. He knows nothing. For him, everything is new. And whatever, things you'll show, the love you'll show, your aura, all of that is going to reflect on your kid. And that is how the kid can be a happy kid or a sad kid. So it's all, mothers have a lot to do. Mothers have a lot of role to play. And that is why, this way also, if you keep realistic goals, realistic expectations about yourself and your baby, you will be able to manage this problem better. Exercise. Now, within the limits of restrictions by doctors, come into place of your levels of activity. Take a walk, get out of the house for a break, take a break when the baby is sleeping, spend some time with your partner. Expect some good days, some bad days. All days are not good, even with the baby or without a baby. So, have realistic expectations that some days are going to be good, some days are going to be bad. But make sure to enjoy this phase of motherhood, because once the baby grows up, that phase goes away. Your depressive thoughts may go away, but somewhere that may affect your little one also, right? Follow a sensible diet, avoid alcohol and caffeine, because these things can also interrupt with the functioning of your hormones in your system. Foster the relationship with your partner, make time for each other. Like, see, as much as motherhood is new for the new mother, it is also new for the father, right? So if somebody is going through this phase, how do you manage yourself? How can you make sure that this postpartum depression doesn't affect you? By spending time with your loved ones, by spending time with your partner, right? Talk with him. Sit alone in the house. When the baby is sitting, make a special place for yourself. Sit, talk to each other. Communication is the best way of managing any kind of problem or relationship. Keep in touch with family and friends. Limit visitors, when you first go home. Initially do that, because sometimes some people screen phone calls. And sleep or rest when your baby sleeps, right? I know it's easy to say that you sleep when your baby sleeps. Sometimes it's not possible, but to understand that you need enough rest. And if your baby is resting, you need to rest too, right? Now, like I'm here today to tell you how Bagdara Farm supplements help, because our supplements are made out of curcumin. Now, curcumin is a component found in turmeric which has medicinal, pharmacological, physiological, and therapeutic properties that can help with managing more than 856 ailments in the human body, and that is because of the 287 plus pharmacological abilities it exhibits. The product which we have today for you is Stressidra, right? Stressidra is a product which is made up of high percentage curcumin. You can go on our website, which is www.bagdarafarms.com. On the website, we have our product section. In the our product section, we have the product Stressidra. STR, you write stress idra, IDRA. So stress idra is the product which we recommend for postpartum depression. How it helps, just listen to what I'm going to be telling you, and you'll understand in brief that how stress idra, a curcumin enriched supplement, can help with problems of postpartum depression, right? So it fights inflammation. That means known for its strong anti-inflammatory properties and high fatty acid content. So what happened? Turmeric can help prevent with swollen breast tissue and clogged ducts, which can lead to a painful flu-like condition called mastitis, right? So it can help because of its anti-inflammatory properties. So any kind of inflammation that is there in the system can be warded off with this property. It boosts immunity. That means when you are short on sleep and anxiety levels are high, your body gets into a fight or flight mode, right? That means letting your immune system fend for itself. Now, turmeric has antiviral, antibacterial properties and is rich in immunomodulatory properties, immune boosting magnesium that can help in fighting off infections. So because it has immunomodulatory properties, it boosts your immunity. Now it promotes digestion. Now what happens is, now that the baby is born, right, your body is readjusting. So when your body is readjusting, the systems are finding the new place again. So this can sometimes slow down digestion, but with a sneaky high fiber content, turmeric helps you regularize and minimize gas and bloating. So if after you give birth, so obviously all of these metabolic things, all of metabolism can go for a 6 after you give birth. So all of these things can be taken care with this, because it promotes digestion. It helps fight postpartum depression because of its antidepressant properties. It also helps with diminishing the appearances of stretch marks, because it can topically be applied also. Turmeric can topically be applied also, Stressidra, or you can also take a product Dermaterm, which can be topically applied on the stretch marks. You have to just mix it with oil, heat it up, and prepare a little bit of oil based solution which is there, and you can apply it on your stretch marks, and that will help in diminishing the appearance of stretch marks. It also promotes lactation. Now sometimes when you're not able to feed the baby, you're not lactating well, that can also lead to postpartum depression, because you feel that you're not giving the right thing to your baby, you're not caring enough for your little one. So while the research is still out on this, turmeric has historically been used in many cultures as a way to stimulate lactation, likely due to the healing and comforting properties it has. It's also a natural detoxifier, wonder spice for your liver. Turmeric boosts enzyme production in the liver that helps your baby, helps your body get rid of toxins, right? So it naturally detoxifies your system. Now, it's comforting, like just like chicken soup can magically cure the common cold, turmeric's warming color and its medicinal properties do wonders for postpartum baby, the postpartum body and mind. If your postpartum body and mind are going to be healthy, it's also going to go to your baby, making sure that the baby is healthier also, right? So it helps clear complexion. Or sometimes what happens, women also have a lot of pigmentation and other kind of skin related problems that happen after giving childbirth, and this is all because of the hormonal imbalance that must have taken place in the body during the phase of pregnancy and post pregnancy. So you can turmeric helps with lightening up these marks and helps with giving you a glowing skin. And it also helps with preventing mommy brain. Now, high in omega-6 fatty acids, turmeric helps improve the blood circulation. It improves brain function, memory, so you can keep track of your newborn to-do list and all the feeding, napping, diaper changes, schedules, etc. So all these schedules can be taken care of when you are physically strong, mentally alert, and are not letting these depressive thoughts affect you. Stresedra is a 100% organic solution, supplement, and the curcumin content in all our products is between 11 to 19%. And understand, if because the curcumin percentage is high, that is why these products are given for medicinal or therapeutic purposes, right? Now, like I said, on the website, which is flashing on the screens, www.bagdarafarms.com, you can see the products Residra there in detail. It is written about its specialities, its functioning, its various properties. I spoke about 10 of the properties which it has. It has many others written on the website. Also, it is written how it has to be consumed. Now, one bottle of Stresidra has 60 grams of powder in it, and it is a course for 15 to 20 days. Try using it for minimum 2 months to maximum. Take it as long as you want. Please understand that when a woman is taking, turmeric, it is also going to your baby if you're feeding your baby, right? So the baby's immunity is also going to get boosted. So minimum time period is 15 to 20 days is one bottle. Minimum time period, which we say, is 2 months. That is, it takes 4 to 8 weeks for organic supplements to show results on the body. The procedure to make it is simple. It is also given on the website. Please make sure you follow the procedure of boiling it and then consuming it. You want to take it with water. Try taking it with water because it's easier to be digested. But if you don't like it with water, you can also try making it with milk, right? For more details, more information, you can also contact us on our number, which is 9560254646. This is our helpline number. You can call us, WhatsApp us, message us with your problems, with your queries, and give us a time when we should be calling you. And we will give you free consultation on call to understand your problems and to give you the best solution and the best usage and dosage period for the supplement, so that that can show results on your body and you can benefit from the same, right? We are also available on various platforms of Facebook, Instagram, YouTube, Twitter, and LinkedIn as Bagdara Farms. You can visit us of any of these platforms, write your queries there, and from there also we get back to you with the best solution which we can get for your problems. On our website, which is www.bagdarafarms.com. On the website, I'm going to be, yeah, this is the website. On the website, when you go, we also have a certification section that is to show transparency and to show you that we are authentic, genuine, and the products are of good quality, and we are certified by USA FDA and FSSAI. We also have a lab report that shows that the curcumin percentage in our products is between 11 to 19%, right? All these details are there on our website, in detail. You can read about everything. You can read about Bagdara Farm, you can read about products. We have a scientific evidence section which shows articles. There are various articles. You can write the problem for which you need. These articles are written on the basis of studies, trials, research carried out to show how curcumin works. So the scientific evidence section is there. Our product section have 44 plus products. You can read about the products from there. And for more information, we are always available on call, message, and WhatsApp on 9560254646, or on our website. You can just simply log into our website, www.bagdarafarms.com, write your query, and then you'll get a call from us to give you the best solution for your problems. So that is all I have for today's live of postpartum depression, right? If anybody needs, and if you need to write something, you write in the comment section. If you think anybody can benefit from this, then do share the video with them, right? You can share the video with them. You can tell them to visit Bagdara Farms site on any of these platforms, and they can these videos, we have a lot of consultants who come and give talks on various topics. So whichever topic is of interest to you, you can share that with your known people, with your friends and family, right? So with that, I come to the end of this live. If anybody is having postpartum depression, fight it, talk about it, and you will be able to sail through it and get out of it, provided you take help and take natural supplements or natural, adopt natural means uh, to treat your problem and to make sure that you give a good life to not just yourself but also to the little one who you've brought into this world. Thank you so much, everyone. Enjoy your morning. I'll see you all again soon. Thank you.